scale of this crisis of addiction is why, soon after coming into office, I convened a presidential commission headed by Governor Christie that has consulted with experts across America to listen, to learn, and report back on potential solutions. We await the final report, which will come in next week, and I know some of the report has already been seen because I want to see it as quickly as possible, and some of the things that they are recommending are common sense but very, very important, and they're going to have a tremendous impact. Believe me, tremendous impact.
That was President Trump on Thursday during an announcement where he declared the opioid epidemic a public health emergency. The man leading the administration's Commission on Combating Drug Addiction praised Mr. Trump's move. New Jersey Governor Christie said in a statement that he commends the president's, quote, bold action. Christie has made tackling the opioid crisis his final mission while in public office. And the soon-to-be former governor talked about his last fight in an article for GQ. Jason Zengerle is GQ's political correspondent. He interviewed Governor Christie, and he joins me now via Skype from Chapel Hill, North Carolina. Welcome to you, Jason.
Hi, how are you?
Well, so is the president's declaration Thursday what Governor Christie's commission specifically asked for?
Well, they asked for one of two things. They asked for it either to be declared a national emergency, a public health emergency, or a national emergency through the Stafford Act. So technically, Trump did do one of the two things they wanted by using this Public Health Act. That said, this is so late in coming. They've been waiting for it for so long, and the national emergency would have opened up money immediately. You do have to think that this maybe isn't exactly what Christie wanted, even though he's made a point of saying it is one of the things the commission asked for.
So what else? You talked about the money, but what is the exact difference between a national emergency and a public health emergency?
Well, the public health emergency has to be, it only is for 90 days. It has to be renewed, and the authorities granted are not nearly as broad. The national emergency would have opened up money right away, and it's indefinite. So this is something that's going to have to be renewed. Additionally, there's no money right now made available for this effort. They're going to have to go to Congress. They're going to have to get it. And that's been sort of the story of this whole effort. Christie's commission, I think, did a pretty good job. It conducted serious hearings. It had important witnesses. I think everybody who knows something about this issue felt that the commission acted responsibly and took its duties seriously. The problem has been the actual follow-through from the administration. We've been waiting for President Trump to actually act on this for months now after saying he was going to, and he hasn't. And I think that's going to be the biggest issue, the follow-through. And in that respect, there really isn't much that Christie or the commission can do. They can make the recommendations, and I think Christie talked to me a bit about how he had specifically kind of tailored the report for Trump.
Why did he do that?
He said, Well, he knows, he knows Trump well. He knows him from before the presidential campaign, and he got to know him, I think, even better during the campaign. And he talked to me a little bit about how Trump processes information. He helped Trump with his debate prep against Hillary Clinton. So he came to understand, what works for Trump, how he kind of retains information, what makes an impression on him. And he told me that he took the first draft and he edited it down by, I think, almost 2/3, because he realized that, if you hand Trump this 80-page white paper, he's not going to read it. So Christie really tried to make it a document that would actually resonate with Trump, and it sounds like he did, and Trump was impressed by it. But then, like so many other things with this administration, it just takes a long time for anything to happen.
Well, how has Governor Christie addressed the drug crisis throughout his time in public office?
It's an issue that's been important to him from when he was a county freeholder. He got sort of stuck with the public services portfolio because he was the newest member, and he went to visit an addiction treatment center as part of that job, and came away impressed and got involved in the issue. And I think his county, thanks to his efforts, was the first one to pay for addiction treatment. As governor, he's been pretty proactive on the issue in terms of signing legislation that a Good Samaritan law that allowed for people to report overdoses without getting in legal jeopardy themselves, making more treatment beds available in the state. He had a personal involvement with it as well. One of his friends from law school developed an addiction and ultimately died from it, and I think that made an impression on him. And then during the presidential campaign, it was it was a tough campaign for him in a lot of ways. But when he talked about the addiction issue, which obviously resonated in places like New Hampshire, it really sort of helped him, and I think kind of showed maybe even a softer side of him that people weren't familiar with. Right. So it's an issue that he personally cared about, and I think saw that there was some political gain to be had from as well.
I want to talk more about that personal connection in a minute, but in your piece you mentioned a link between Christie's infamous beach photo during a government shutdown and opioids. Can you explain that for us?
Yeah, so everybody remembers the beach photo, obviously. There was a shutdown. Right. No one could go to the beach, any state-run beaches in New Jersey that weekend. Christie himself went, was taken, was photographed. The thing that people kind of forgot, and the thing that Christie, I think, was a little bit upset that they forgot, was the reason for the shutdown was because Christie was in a fight with Democratic state legislators over $300 million he wanted to spend on his opioid efforts for addiction treatment. And there was a question about where they were going to get the money from. I think Democrats didn't like how Christie was planning to take the money from an insurance company's surplus. And that's what the fight was about, technically. I don't think Democrats were opposed to addiction treatment efforts. But, right. But ultimately, Christie was trying to use this money to combat opioids. Democrats didn't want him to. They shut down the government over it. I think Christie thought that he was going to have leverage over these Democrats. He's very good at, bullying his opponents. And I think he planned to bully the Democratic speaker. He hung signs up on all the government buildings in New Jersey with a picture of the speaker saying, "This man is why your government's closed." But then a day later, the photos come out of him on the beach, and whatever leverage he had went out the window. Right. And he agreed to a budget deal that didn't include the $300 million.
Well, what kind of challenge does Governor Christie face when working with the Trump administration further on this issue, particularly with Attorney General Jeff Sessions?
Well, Attorney General Sessions has a different mindset, I think, about drug enforcement in general. I think he views it as more of a law enforcement issue, not so much as a medical issue. And I think, Christie, views it as a law enforcement issue when it comes to people selling drugs and distributing them, but not when it comes to people using them who are addicted to them. And there's just a fundamental disagreement there. I do think right now, at least, Christie seems to have prevailed with President Trump about the way to handle opioids, at least how to think of them. I mean, the question now is going to be the follow-through. And, in that respect, Christie doesn't have a ton of leverage. I mean, he's not, he chaired this commission, but the commission will presumably disband unless Trump reauthorizes it. And Christie isn't part of the administration right now. I suppose he could be at some point, but he's not going to be able necessarily to follow through on this inside government. I think he can probably keep up public pressure outside, but at the end of the day, he's going to be depending on President Trump and people who work for President Trump in the administration to actually carry this thing out.
Yeah, it's such a critical issue. It'll be interesting to see what role, if any, Governor Christie plays or takes or chooses to take on from outside of government. All right, Jason Zengerle, fascinating piece. Thank you so much, Jason.
Thanks a lot.